Arthritis pain, arthritis inflammation, high intensity interval training. What can one have to do with the other? Well, you can be quite surprised. Counterintuitively, or I should say intuitively, you would think if your joint hurts and you push it even more, it's going to make it worse. And who could blame you, because that makes sense. However, though, that may be totally counterintuitive. Let's begin with the research titled High Intensity Training Helps Ease Arthritis Pain. In the citation title, in case you want to do your own research and look at the abstracts, the effect of high-intensity interval training in women with rheumatic disease, a pilot study published in the European Journal of Applied Physiology this May 2015. Now, up to this point in time, there was not a lot of research in regards to exercise and arthritis. Obviously, it seems to make common sense. If your joints are hurting, the more you move it, maybe the more you're going to damage it. Well, obviously, the obvious wasn't the answer. Let's get into what they did to these participants and how they discovered that, hey, high-intensity interval training was actually found to be beneficial. In short, and I'll go more into detail in regards to the exact exercise at the end, participants performed high-intensity interval training, otherwise known as HIIT, consisting of four-minute intervals at 85 to 95% of the max heart rate, whatever their age group is, twice a week for 10 weeks on spinning bikes. And this is what they discovered. Rather, we saw a tendency for there to be less inflammation, at least as measured by C-reactive protein, and the participants in the study had a solid increase in maximum oxygen intake. They breathed better, the inflammatory compounds which are in the body actually went down, which is counterintuitive of what we would normally think. You would think exercise would increase them. At least at the time that they did these tests, the C-reactive protein was actually lower. And to proceed forward, the participants saw a small reduction in the body mass index, body fat percent, and waist measurement, as well as an increase in muscle mass as a result of the training period. So everything that you normally think would happen, you would think normally exercise, damaged joint, more pain, things would get worse. In reality, there was no adverse effects. It actually got better. And that's the part that's kind of amazing in regards to this high interval intensity training, HIIT training, I should say, and basically the arthritis. It got better. Now, this is exactly what they did. To give you more of a breakdown. The study took place at a training studio. Won't go into the name right off the bat. The participants warmed up for 10 minutes at 70% of their maximum pulse and did 4 repetitions of high intensity, again 85 to 95% of the max pulse for 4-minute intervals. The break between each interval was about 3 minutes at 70% of max pulse. The total workout session was only 35 minutes. And this 35-minute workout section only happened twice a week for 10 weeks straight. It was so successful that even, I should say, a good portion of the participants themselves decided to continue doing this even after the study had come to completion. So, high-intensity interval training, arthritis, appears to be a thumbs up. I hope this helps. Again, before engaging in any exercise program, please do it in conjunction with a professional, a medical professional, especially when it comes to the rheumatoid arthritis, and just see what happens. But it turns out the more you move, the better you do. Ralph Turchiano, signing off once again, and I really do hope this helps. Thank you.